Atul Goyal ji, Director General Health Services, Dr. Dheeraj Shah, and international partner organizations, faculty, staff, students, and friends from the media. My greetings to all on the occasion of the 48th Annual Day celebrations of the Institute. It's indeed a momentous occasion which helps us to reflect on the unwavering commitment that this esteemed institution has had towards strengthening India's public health landscape through education, capacity building, as well as research. Friends, today India has entered into a new era of public health, where, guided by our National Health Policy 2017, we are focusing on enhancing universal health coverage. Schemes like Pradhan Mantri Ayushman Bharat Jan Arogya Yojana and the Ayushman Arogya Mandir, we are trying to strengthen our primary, secondary, and tertiary healthcare services for the citizens of this country. Also, there is constant strengthening of medical education. As you can see, there has been an increase in the number of medical colleges in the country. Before 2014, we had around 380 medical colleges, and now the number has increased to almost 787. So there's almost a 101% increase in the medical colleges. Strengthening our tertiary health care, we've also enhanced the number of All India Institute of Medical Sciences from 6 to 22, and it's a constant process. So the healthcare landscape is changing as we continue to advance the accessibility of affordable and quality healthcare. We're trying to provide affordable medicines by way of our initiatives like the Pradhan Mantri Jan Aushadhi Pariyojana. Today is 9th of March. On the 7th of March, we celebrated the Jan Aushadhi Divas. And when we see a remarkable change that is being brought in the lives of a common Indian, insofar as the out-of-pocket expenses reduction is concerned, when they make use of the drugs and the surgical equipments which are available at the Jan Aushadhi Kendra. Amrit Pharmacy is also one such initiative which is making the branded medicines available at discounted prices to the common citizen of India. So that's how the landscape of public health has changed, and India, as I said, has entered into a new era. And when we see this transformation in our approach from curative health to a promotive, preventive, rehabilitative, curative healthcare, there is a different role that the Institute is also expected to play. I heard the annual report read out by Director Dr. Dheeraj Shah, and I was happy to hear that there has been constant progress in the number of training sessions which have been conducted by the Institute. Past 1 year, more than 100 training sessions were conducted for over 4,000 health professionals to help them gain the skills which are necessary to tackle with the complex healthcare challenges of this country. And this year itself, I heard the director mention that it's just the beginning of the year and already more than 132 training sessions have been conducted. So this is absolutely commendable. Also, more than 100 training sessions have been conducted for the hospital, senior hospital administrators, and COVID-19 has given us some very important lessons. So now, when we think of strengthening our healthcare systems, we also think of getting prepared for another pandemic. So, insofar as the preparedness for pandemics is concerned, or the rising threat of antimicrobial resistance, which is now being discussed worldwide, is concerned, also the impact of climate change on health is concerned, I am glad to learn that the Institute has also been proactive in conducting specialized training programs for the healthcare professionals to enable them to deal with these challenges as well. The faculty here is also being updated constantly in their skills and knowledge, and which is really a necessary step. And I'm glad the institute is taking the desired steps to ensure that the faculty is all updated with the newest technologies and trends in education as well as research. Under Rashtriya Karmyogi Jan Seva program, I'm delighted to know that more than 200 officials of the Ministry of Health and Family Welfare have been trained by the National Institute of Health and Family Welfare. It's providing its services in creating and reviewing the public health courses on the iGot platform, and also hand-holding other institutions in developing the courses for iGot. And today, we've had the privilege of inaugurating the new digital learning media lab, which will help to create in-house content of these online learning training modules. So this is a very important initiative which the institute has taken, and I sincerely appreciate this effort. Just few days back, we had the Manthan Shivir in our ministry, and we were, there was lots of churning of ideas which was taking place in what more can be done to improve the efficiency of our various initiatives and programs. So this digital learning media lab was one such idea that emerged out of the Manthan Shivir, and I'm glad the director of the institute has taken the initiative to execute it and bring it into existence. So I convey my best wishes for this new initiative, and I'm sure lots of good work will be done by way of this new thing that has come up. Friends, considering the urgent need of qualified public health professionals in the country, it's also important to devise new academic programs which will develop specific competencies among the students to meet the public health challenges. And in this regard, the academic endeavor of the institute to introduce a master's in public health as well as doctoral in public health will further enhance and enrich the academic prowess of the institute in the field of public health. The distant learning courses will also fill up the gap of public health education needs of the professionals who are unable to enroll in the regular courses because of their occupation or location. Coming to research now, I heard Professor Dheeraj Shah mentioned about the remarkable contributions that have been made through the evaluation of various national health programs. These research endeavors underscore the Institute's commitment to evidence-based policy making, helping India navigate the complex health challenges with data-driven strategies. I'm also happy to learn that the Institute has been supporting the Swachh Bharat Abhiyan and conducting the external assessments of the central government institutes and the hospitals under the Kaya Kalp initiative, which is basically to promote sanitation, hygiene, and infection control practices within the hospital premises. And the Institute's contribution to this Swachh Bharat Abhiyan will also have many positive implications for public health in times to come. Today, we've also inaugurated the Arogya Shakti Park. This is an initiative to promote physical and mental well-being of the Institute's employees and their families. And just few minutes back, Director General Health Services was talking about the need for physical activity and fitness, and I'm sure this initiative that we have taken today by establishing an Arogya Shakti Park will certainly promote people towards maintaining fitness and a healthy lifestyle so that we are able to move towards preventive health and not have to adopt curative health. So this is a very, very good and a commendable step. And today, as we celebrate nearly 5 decades of the Institute's excellence, I congratulate the Institute for its adaptability, resilience, and commitment to shaping India's public health ecosystem. Once again, my congratulations to the entire NIHFW family, its leadership, faculty, researchers, students, and staff for their relentless dedication to advancing public health. May this institution continue to flourish, innovate, and lead the way in shaping the future of public health capacity building and policy for the nation. Thank you, and my best wishes to the Institute for continued success. Jai Hind.